Hey guys, my name is Sean Maginnis, and along with my classmates, Charlee Cook, Lyons, and Tiffany Zampoli, we have put together a presentation for you on marijuana use today. I think before we jump in, it's important to mention that I think we're at a really interesting time in our country in terms of marijuana use. There are definitely some conflicts that have arisen in terms of state versus federal law. You see, notably, Washington State and Colorado have recently legalized the recreational use of marijuana, while it still remains a crime to use it at the federal level, except for some medicinal purposes. You also saw over the summer that the National Football League, during their collective bargaining agreement with the NFL Players Association, now allows the players, as of this last summer, to use marijuana and to test positive for it in drug screens without risk of suspension. So we are at what I think is a really interesting time because we have a lot of conflicts between rules and laws at the state and federal level in terms of marijuana use. So, with that, let's go ahead and jump into specifically what is marijuana. It includes the dried leaves, flowers, and seeds of the cannabis sativa or cannabis indica plants. It goes by many names, most of which I'm sure you've heard before, such as cannabis, weed, pot, grass, wax, and several others. The plant is made up of hundreds of cannabinoids, which are the active ingredients, and there are two major active ingredients. Those would be THC and CBD. THC stands for the delta 9 tetrahydrocannabinol ingredient, which is the psychoactive compound responsible for that feeling of being high that occurs when marijuana is used. And then there's also CBD, which is not a psychoactive ingredient, but can help to treat anxiety, depression, pain, and cancer-related symptoms. We have a few pictures here of the plant itself, if you're curious what those look like. So there are many, many ways to use marijuana, and I can almost assure you as time goes on that people will come up with more uses. The three main ways at present are inhaling it through smoke, inhaling vapor, or ingesting edibles. The smoke method includes joints, which are hand-rolled cigarettes, blunts that are cigars that have been refilled with marijuana, pipes and water pipes, also known as bongs, bowls, or secondhand smoke is another common way that people do inhale that substance. Inhaling vapor is a newer way to ingest marijuana that has come up in recent years. People use vaporizing devices or vape pens that avoid inhalation of smoke by extracting the active ingredients and putting them into a vapor that is inhaled instead, although that on its own doesn't come without its own risks, depending on which type of vaporized product you're using. It can also be ingested in edibles, which are food products that are created using a butter or an oil made with marijuana. You'll often see these baked into brownies or cookies or candy made with the same product. And later in the presentation, we'll talk a little bit about some of the differences of the different ways to use it and how those can carry their own risks depending on how it's used. In terms of the medicinal use of marijuana, it is the same form in most cases of recreational marijuana, but it is taken for medical purposes. The FDA has approved it for two serious and rare forms of epilepsy, that's Dravet syndrome and Lennox-Gastaut syndrome. And research is currently underway for other uses, but their effectiveness has not been determined yet, including Alzheimer's, eating disorders, mental health conditions such as schizophrenia or PTSD, as well as Crohn's disease, and for pain and nausea. In terms of addiction, statistics show that marijuana will become addictive for 1 in 10 users. And it's important to note that people who are under the age of 18 that use it, that addiction rate does rise up to 1 in 6. Some of the manifestations of addiction include unsuccessful efforts to quit marijuana, as well as people who give up activities that were once important to them in terms of hanging out with friends and family in favor of using marijuana, and continuing to use marijuana even when it causes problems fulfilling daily tasks such as chores at home or school or work. People who use marijuana are at higher risk for several problems related to attention span, memory, motivation, and learning, and can also have impacts on people's relationships and mood, school performance, and those changes can be temporary or permanent. It's important to note as well that that impact is highly individual. It depends on a lot of factors. It depends on the amount of THC that's present in the product that you're using, the frequency of the use, how old you are when you first use it. Obviously, the younger you are when you first start using, the higher impact it will have. And also if you're using it with other substances such as tobacco, alcohol, or other recreational substances. There are some risk factors related to dosage as well. So those risk factors are generally related to the dosage of THC, as we mentioned a minute ago. They include addicted users requiring more THC to get high. It depends on the fact that the average THC potency has actually increased over the last few decades. So the marijuana and marijuana products that are being used now actually have a lot more THC than even, a couple decades ago. And also other non-smoking methods such as dabbing and edibles can contain quite a bit larger amounts of THC, which carries its own risks. The reason that higher THC content matters is that the more there is, the stronger the effect that it will have on the brain. Scientists haven't figured out the full extent of consequences in the body and brain, especially on the developing brain, and the link between increases in THC and risk of addiction aren't currently known. And while I know that may sound contradictory to what I've just mentioned in previous slides, it just shows that there's a lot that we don't know about marijuana and how it affects people, and how there's also quite a bit of disagreement in terms of its actual effect on the human body. So in terms of cancer risk, man-made forms of marijuana have been found to be beneficial in treating some forms of nerve pain or neuropathic pain from cancer, as well as nausea and vomiting from chemotherapy. However, if you're smoking marijuana, it not only delivers THC, which has some of those beneficial effects for cancer patients, it also has harmful substances such as those found in tobacco smoke. It's harmful to the lungs and the cardiovascular system, and there's also some limited evidence that the smoked form of marijuana can increase the risk for testicular cancer. Chronic pain treatment is one of the most common reasons for using marijuana, and some studies have found that it's helpful for neuropathic pain if we treated. There's limited evidence currently that it helps with chronic pain, and a statement you're going to hear me making many times throughout this presentation is that more research is needed because currently there's just a lot that we don't know about it. Marijuana can cause increased heart rate. It can also increase the risk of stroke and heart disease. However, most of the studies that studied these increased risks to the heart and risk of stroke were performed on smoked forms of marijuana. This is important to mention because it's difficult to separate the negative effects of smoking from the negative effects of THC risk. Based on that, we're going to hear that key buzzword, more research is needed. There are potential lung problems associated with marijuana use, and they're all related to the toxins, irritants, and carcinogens that come from smoking marijuana, similar to using tobacco smoke. Those include harm of lung tissue. It causes scarring and damage to small blood vessels, increased lung cancer risk, and it does also include a greater risk of bronchitis, cough, and phlegm production. These symptoms generally improve after they stop smoking marijuana. There are some mental health risks with using marijuana. These include frequent or daily use in high doses can cause disorientation, unpleasant thoughts, as well as anxiety and paranoia. Marijuana users are also much more likely to develop temporary psychosis, long-lasting mental illness, including schizophrenia, and it has been linked to depression, anxiety, and suicide among teens. Right now, it's unclear if the symptoms that I've just mentioned in teens are caused by marijuana or possibly other factors. We're going to go ahead and place that under that umbrella of it needs more research. The risk for poisoning, there is a risk for poisoning in marijuana, although fatal overdose is highly unlikely. When someone overdoses, you are going to see effects that are similar to, but more severe than the typical effects of using marijuana. And in some cases, they may require medical care. These include confusion, anxiety, paranoia, panic, delusions, hallucinations, cardiovascular effects such as faster heart rate and increased blood pressure. You can see severe nausea or vomiting. And one of the big risks is getting behind the wheel while using marijuana. This can increase your risk for motor vehicle crash, fall, or if it's used in concurrence with other substance, you can be at a higher risk for poisoning with those other substances. One thing that's been discussed for decades at this point is marijuana as the gateway drug. It's a large source of disagreement depending on your on the research that you've done or your political leanings, and it's definitely one of those topics where more research is needed. However, at this point, statistically, most people who use marijuana will not go on to use other more dangerous drugs such as cocaine or heroin. General risk factors for marijuana addiction are the same as many other forms of substance abuse. Those include a family history of addiction, mental health problems or mental illness, peer pressure, people who are lonely or socially isolated can use it to self-medicate, as well as the availability and substance of the drug. And socioeconomic status also plays a role in your risk factor for marijuana. Some of the adverse effects, if we're looking at those from a nursing standpoint, it can cause cannabis hyperemesis syndrome, which is a condition that causes severe nausea, vomiting, and diffuse abdominal pains. Having seen this in a patient personally, I can tell you that it is not fun. People who have this are not enjoying themselves. Symptoms usually last 24 to 48 hours, but have been described to last as long as 10 days. Patients have found that hot showers can help reduce these symptoms. Although right now, it does fall under that umbrella of more research is needed, because right now the pathophysiology is not very well understood, although there are currently theories that say that it's because of the dysregulation of endogenous cannabinoid system that is caused by the desensitization of downregulation of its receptors, which is quite a mouthful. When we are treating folks who are dealing with this, one of the first line treatments is capsaicin cream. We can apply this 3 times a day to the abdomen and the back of the arms, as well as antiemetics to help with the vomiting. In terms of nursing implications, we definitely want to avoid giving opioids in treating the pain that goes along with cannabis hyperemesis syndrome, because it can actually exacerbate those symptoms and make things worse. And the only intervention currently known to completely resolve the symptoms is to stop using the drug. It has also been shown to increase sympathetic tone and decrease parasympathetic activity, as well as causing premature atherosclerosis, as well as several other cardiovascular events as listed here below. You'll definitely want to be monitoring folks' EKGs when they are using marijuana if they end up in your ER with that hyperemesis syndrome, because it can cause hypokalemia, and it has been shown to be linked to acute coronary events such as myocardial infarction and sudden cardiac death as well, although their incidence seems to be a lot higher when using synthetic cannabinoids, so the synthetic versions of marijuana as opposed to the naturally occurring versions. So one of the reasons we're here today is to talk to you about the effect of marijuana on the NSCC campus. Looking at college students in general, 30% of college students have reported using marijuana before beginning college, and about 8.5% of students report using it for the first time in their freshman year. College students who use marijuana before college typically continue using it, and factors that coincide with the continuance or initiation of marijuana use in college include using cigarettes at the same time, as well as alcohol or hookah, loose religious affiliation, or use of any other illicit drug, as well as living on campus. Living on campus making it less likely that you will continue to use it. The rates of college students using marijuana throughout college, use in the past year of marijuana is similar for college and non-college students age 19 to 22 at 43%. And in the last 5 years, use of marijuana among college students has risen about 7%, reaching historic 35-year highs. Marijuana can have many effects on academic performance. The most negative effects are generally seen in first-generation minority male students who are using marijuana. There is a correlation that exists between marijuana use and skipping class, and the frequency of marijuana use inversely correlates with first-year GPA. So the more you use marijuana, the lower your GPA, as studies have found. Each increase in the frequency of use of marijuana reflected a similar drop in GPA throughout college, and the frequency of marijuana use was not a direct predictor of delayed graduation, but marijuana's effects on class attendance and GPA did have a striking second-order effect on delaying graduation. It's important to note that the effects on academic performance are similar to those of alcohol use or other illicit drug use, so marijuana isn't alone in these negative effects on academic performance. The use of marijuana and increasing frequency throughout college doesn't predict more skipped classes, but still predicts a decrease in GPA, suggesting that several factors about frequent marijuana use contribute to poor academic performance. Studies have shown that students are receptive to targeted interventions that reduce the frequency of marijuana use, especially if they're used within the context of helping them remain in college. So that can be an effective way to get students to reduce using it, is to teach them through the lens of using marijuana will help them graduate college on time. Goals that prove effective are centered on promoting the long-term collegiate success and not on punitive action. So punishing students for using marijuana has not been found to be helpful in helping them graduate school on time. So the info that we've listed on the previous two slides provided some clear warnings to college student population at Nashville State and colleges everywhere. There are just more students using marijuana on college campuses, and an increasing number of students who are using marijuana within the first year of school. It impacts your GPA and the amount of time that it takes to graduate. Interventions are helpful, but only when they're targeted at helping them graduate and not at punishing them for using marijuana. If you are somebody who is using marijuana currently, or a friend or family member of someone who's looking to reduce their use, we do have some resources listed below. We have contact for the Nashville Marijuana Addiction Treatment, as well as Substance Abuse and Mental Health Services Administration, as well as the Marijuana Anonymous Resource Center online. And we have provided resources there, phone numbers and website if you would like to make use of any of those. We'll go ahead and list up some works cited here, and I won't bore you by reading those, but I hope that you learned a little bit about marijuana use, how it affects people, some of the nursing interventions, as well as what effect it has on college students, and how we can help them reduce the use of marijuana to graduate school on time. So thank you guys for watching, and we will see you next time.